Dr. Sachin Gupta to share this about critical moments at the highlight of the year.
Good afternoon, friends. So, this year we are conducting the 32nd annual conference of critical care medicine, Criticare 2026 at Chennai. This is a 5-day event. The first 2 days we have conducted 15 workshops at 3-4 different locations, and then the next 3 days is the conference. The scientific content will be shared here. So Friday, Saturday, and Sunday is when the conference is. We have registered almost more than 3,000 total delegates for this conference. We have more than 300 faculties, both national and international, and more than 50 international faculties who will be sharing their experience. People on the dais that you see are the ones who are responsible for creating the scientific program that you will be seeing over the next 3 days. A lot of exhibitors have participated in the conference and they have shared their confidence in the scientific content. The main theme of this year's conference is humanization in the era of data science, which means we all know that nowadays artificial intelligence is everywhere and medical science is also not untouched. But how do we as doctors continue to maintain our empathy, our humane touch towards the patients with the help of getting more information, more analysis of artificial intelligence? And that is the theme of this year's conference. In these sessions, various sessions, you will hear about the burning issues in critical care like antibiotic resistance, what we call as antimicrobial resistance. So we will hear from the leading experts in this field how to combat this antibiotic resistance, how to fight these dreaded infections which happen where only very few options are left. We will also be looking at sessions which cover the various organ support systems like ventilation, dialysis support, liver support, heart support, ECMO support. So the conference will revolve all around this. I would request Dr. Srinivas, who is the president of this society and the current chairperson of Criticare 2026, to share more light on the scientific content.
Thank you. And on behalf of the Indian Society of Critical Care Medicine, we are extremely grateful to all of you for joining us this afternoon for this interaction. The society has always been in the forefront of looking after patient care and their interests and their rights as well. As Sachin has said, with the arrival of data science, a lot of people have a fear that we become impersonal in our interactions with our patients, which is what we are trying to dispel. Because data science and artificial intelligence are only going to improve the way we tailor or fine-tune the therapy for each individualized patient, which is called in our terms as personalized care. So that is what data science is all about, and that's what we are trying to do. The scientific content will focus on a lot of such issues. A little bit about the society. It's a charitable society, not-for-profit society, which takes training and education as its motto. That's the driving fabric of this society. And we have also embarked upon a lot of corporate responsibilities, social responsibilities rather, not corporate, in the terms of training school children in how to do CPR, that is resuscitating these children and people who collapse on the road. So in the last 1 year, the society has contributed about 100 training mannequins or models to our branches, about 105 of them at a cost of about 10 lakhs. And we have trained about 90,000 students across the country in doing life-saving CPR. We have also extended this to airports. The first session was done at the Guwahati airport, and we are also taking it to gated communities where the elderly and the needy reside. Apart from that, the society has got our training programs for nurses, for pharmacists, for respiratory therapists, and nutritionists, so that the care that is delivered to the patients is global and comprehensive. So, if you have time, we are happy to have you visit all our sessions, listen to national and international speakers. We have about 50 international speakers who have come. Some of them have come on their own from as far as UK and the United States to share their experience and learn from us as well what intensive care is practiced in a different way in India. So welcome again.
Indian Society of Critical Care Medicine is one of the major stakeholders as far as infection management and infection control is concerned in the entire country. And we as intensivists, we see the most worst kind of infections which can happen in the community. And all those patients, they come to intensive care unit for their management. Now, whatever we do in ICU, because that is just, I think, a tip of iceberg, what we are seeing and what we are doing. But the majority of the part which we are not seeing and which is prevailing in the community, that is the most dangerous one. So, as a critical care specialist, we feel that these should be taken care at community level itself, rather than taking all this care in the intensive care unit. So if we keep the preventive part a very strong one, yes, as far as development or developing these infections are concerned, and we try to control this at community level, obviously, and at small hospital level, because whenever we all work at tertiary level hospitals, but whenever we see a patient is coming from a small hospital, they already have carried those infections and now they come to our ICU. And here we face the actual problem. So now what is needed? The awareness which we have at tertiary care level hospitals need to be percolated to the small sector or small hospitals, because they should also know that yes, this is a major concern and we have to handle this kind of infection at their own level. So if they understand, I think the burden will definitely reduce. So what they need to do is that prevention. So infection prevention protocols which they need to implement in their hospitals in a very strong manner. And government is running many projects, and they have issued guidelines to control this infection burden. So that is one thing. Secondly, the inappropriate use of antibiotics. Before the patient comes to our tertiary level center, what happens? They are already dumped with the major antibiotics which we actually use in tertiary care center for highly resistant organisms. And these antibiotics are given at peripheral level. They just take these antibiotics as simple antibiotics and they give it to the patients. And the resultant is finally, because of inappropriate use of antibiotics, these people develop resistance. And finally, the cross infections which happens amongst the patient, and that is very, very important. And knowledge and education, that is one of the important things which I understand needs to be given to all the healthcare workers, that what are the strategies we should apply so that these infections can be prevented. Because what is happening in future, we have very limited pool of antibiotics. If we feel that everything can be done with antibiotics, that is not possible. So we have to follow certain strict infection prevention measures, and that is what I feel that is going to help in future. And secondly, another important thing is our diagnostic labs. We have to strengthen our diagnostic labs so that all those things which comes out of these small centers, it should be provided free of cost. The diagnostic cost is very high. So if they get free of cost these diagnostic facilities, then definitely we'll be able to diagnose the infection in a more fast manner and we'll be able to treat and control also. That's all. Thank you.
Year 2026 mega event in this city of South City of Chennai. So AMR is another thing very frequently high in the India. The reason behind is that the basic is lack of awareness. Lack of awareness not only in the public but as well as in the doctors also. So people are prescribing antibiotic or people are taking antibiotic from the medical store, no restriction on these. So, and other thing that Pradeep Rangappa already mentioned, the diagnostic challenge. Because delaying the diagnosis, delaying the culture sensitivity, all these get precipitated to MR. So we need to create awareness in the both levels, in the public and as well as the community. Community, that means in the doctor's education and paramedical staff and infection control practices, especially in ICU. So that is all three things we can do together, we can achieve our goal. Without doing these all three things is very difficult, and this is very challenging issue in the coming years.
This is a huge problem, the antibiotic resistance, and the worst thing is that we face a roadblock when there are infections with certain organisms, and we have to take preventive and protective actions to avoid that for the population to be safe. So there are multiple steps to bring it to that level of safety. And it, as Dr. Ravi Tyagi said, it starts from avoiding unnecessary antibiotics to prescribing antibiotics responsibly and identifying infections rightly and giving the right antibiotic with the right dosing. And it is just not that. It also involves an awareness on infection control and infection prevention. Preventive actions also matter. And how the whole, in an organization also, the whole staff from top to, at all levels, I would say, need to be aware on practicing in everyday hospital practices to avoid infections. So infection control is equally important in this area.
Thank you, Doctor.
I think most of you would have heard about the rising incidence of antimicrobial resistance. And if you look at the global statistics, in the coming days, antimicrobial resistance and infections in the intensive care unit or in the hospitalized patients or for that matter in the community will be one of the major reasons why people are going to die. And the sad part is there are phenomenal advancements which are happening in the industry of healthcare. But when you look at the specific field of managing infections, the kind of innovations and developments that we want are not happening for multiple reasons. And that is the reason why in a country like India with 1.4 billion population, right, not having the regulations upon how to prescribe antibiotics or how to deliver antibiotics, we are going to face a major challenge. And antibiotics are a very different kind of drugs. For example, if you don't use a specific drug in a specific population, only that particular individual will get affected. But antibiotics are a class of drugs which are going to affect the entire community. So anybody can be a collateral damage. You may not use an antibiotic, but if there is misuse of antibiotics in the community and if there is increased drug resistance in the community, then some of your near and dear ones may be affected despite they not being exposed to antibiotics in the past. So that is the challenge that we have to face, and unless we have trainings, repeated trainings, creating awareness, getting regulations, and from the industry side, innovating in technologies, for a population of 1.4 billion, we can imagine the number of people who are going to be affected in the coming days. So the idea of having this conference is to not only create awareness, but also understand and learn the science behind how to prescribe antibiotics. So writing an antibiotic is probably the simplest thing. That anybody just go to the medical or anybody gets a cold cough fever, you just pop up some antibiotics. That's not the way you should use antibiotics. So there is a science behind how you write an antibiotic, who should get, when should they get, why should they get, for how long should they get.
So until and unless each and every medical practitioner in the country starts practicing it meticulously, I think the coming days are going to be very, very risky for a large number of Indian population. So the whole idea, or one of the themes, or one of the key core areas of this conference is to discuss this science, understand this science, share the knowledge, and not only train ourselves, but also train the next generation of doctors who are going to be the leaders of treating patients in the coming days. Thank you.
This was already was discussed by the senior speakers. I would like to add on very few things. That there is two pathway of this. One to go to the community level to the people, and one to the physician, the treating physician, and among the treating physician and all the subspecialty. So all the motto of this conference is that we have to keep the awareness from the physician side as well as from the community level to make sure that the use of antibiotic is not like just a paracetamol or just a medication to just go to the pharmacy and just take it for any fever or any kind of things. Because nowadays what we see we are more focused on seeing all the medication prescribed by the Instagram or the Facebooks. And we try to get all these things that whoever is suggesting, they make some so-called influencer and then get it done. Actually, those people are getting, if you are not scientifically valid data, then we are going to reaching the era when we don't have any medication to treat it. I think you will be very careful about that. So, and this all conference on behalf of Indian Society of Critical Medicine, we would like to focus on the doctors, the future generation doctors, and even the doctors to get their knowledge updated such a way that they come into data not by what I know and you know, based on the scientific evidence, and that's all the ethos of the Indian Society of Critical Medicine. And we also understand that it is not only done in one-sided, we also have to, as Dr. Srinivasa mentioned that certain points, that we also have to make sure go to the public and make them awareness that it is not that, because in India it's very simple, you can go to the shop, you can get the medicine, you can take the medicine, even the pharmacist who is staying there, they can prescribe the medications. So it's our responsibility to make them aware of that you have to take a medication, you should know that why you are taking the medications. It's not as simple as it is. And if you can get into two way, we can almost under damage control. Because this is not the issue of today. This is what the world we are going to provide for the next generations. And if we are not able to provide a good world for the next generation, not only we will suffer, or all future generations will be suffer, and we will be held responsible for that. So it's our moral responsibility for make these things happen. That's the pathway Indian Society of Critical Medicine has taken to get the done with the both way, not only the community but also the doctors making it. On that notes, I think that will be the message should be very loud and clear that if you want to get a medication, it should be based on the scientific evidence, not based on any voodoo medicine.
My name is Dr. Sachin Gupta. I am the organizing secretary of Criticare 2026. With me is Dr. Srinivas Samvedan, who is the organizing chairperson of Criticare 2026, and Dr. Kalavati, who is my counterpart, and she is the co-organizing secretary at Criticare 2026. This year, the theme is humanization in the era of data science. It's a 3-day conference, will be attended by more than 3,000 delegates across the world. So there are delegates from other nations as well, more than 50 international faculties and more than 300 national faculties. We will be covering all topics that affect the patients who become critically ill and they get admitted to ICU, whether that is lung issue, heart issue, brain issue, kidney or liver. So this conference will discuss these important aspects from the leaders across the world in different specialties of critical care, and it will help us in understanding the issues, and it will also help the community when we are able to find solutions to these life-threatening conditions. Thank you.
Dr. Kalavati, in the Criticare 2026 order, co-organizing secretary. So இந்த வருஷத்துல ஒரு வாட்டி நடக்கிற இந்த கான்ஃபரன்ஸ்ல வந்து இந்த நாடு முழுவதுல இருந்து அதுக்கப்புறம் பல்வேறு நாடுகள்ல இருந்தும் கூட எக்ஸ்பர்ட்ஸ் வந்திருக்காங்க. அந்த மாதிரி எக்ஸ்பர்ட்ஸ் கூடுற ஒரு கான்ஃபரன்ஸ் தான் இது. உலகத்துல நடக்கிற எல்லா டெக்னாலஜி அப்புறம் எல்லா டெவலப்மெண்ட்ஸ் எல்லாத்தையும் இங்க வந்து பரிமாற்றம் நடக்கும், கற்றுக்கொள்ளுதல் நடக்கும். அதுக்கப்புறம் இந்தியா ஃபுல்லாவுமே இருக்கிற வேரியஸ் பிராக்டிஷனர்ஸ் இங்க வந்து கிரிட்டிக்கல் கேர்ல, அதாவது தீவிர சிகிச்சையில என்னெல்லாம் டெவலப்மெண்ட்ஸ் இருக்கு, என்ன கைட்லைன்ஸ் இருக்கு, என்ன ரெக்கமெண்டேஷன்ஸ் இருக்கு, என்ன பிராக்டிசஸ் நம்ம ஃபாலோ பண்ணலாம், என்ன பிரச்சனைகள் இருக்கு, இது எல்லாத்தையுமே வந்து டிஸ்கஸ் பண்ணி நம்ம கத்துக்கிறதுக்கான ஒரு 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 நிகழ்ச்சியா இருக்குது. ஸோ இதுல வந்து 3000க்கும் மேலான டெலிகேட்ஸ் பார்ட்டிசிபேட் பண்றாங்க. எல்லாமே வந்து நம்மளுடைய அன்றாட ICU பிராக்டிஸ்க்கு ஹெல்ப்ஃபுல்லா இருக்கும். அதே போல கொஞ்ச நேரத்துக்கு முன்னாடி நம்ம ஆன்டி மைக்ரோபியல் ரெசிஸ்டன்ஸ் பத்தி டிஸ்கஸ் பண்ணோம். அது ஒரு மிகப்பெரிய பிரச்சனையா இருக்கு நம்மளுக்கு. அதை குறிச்சும் இந்த கான்ஃபரன்ஸ்ல டிஸ்கஸ் பண்றோம். அது மட்டும் இல்ல, பிரெயின் இன்ஜுரியா இருந்தா எப்படி மேனேஜ் பண்றது, லங் இன்ஜுரியா இருந்தா எப்படி மேனேஜ் பண்றது, ரோட் டிராபிக் ஆக்சிடென்ட்னா எப்படி மேனேஜ் பண்றது, மல்டி ஆர்கன் ஃபெயிலியர் செப்சிஸ்னா எப்படி மேனேஜ் பண்றது, இதுல என்ன டெவலப்மெண்ட்ஸ் இருக்கு, இது எல்லாமே கூட நம்ம இந்த கான்ஃபரன்ஸ்ல டிஸ்கஸ் பண்றோம். ஸோ இட் இஸ் அ நாலேஜ் ஃபெஸ்ட். சுருக்கி சொன்னா இது கற்றுக்கொள்வதற்கு ஒரு பெரிய நிகழ்ச்சி, ஒரு பெரிய சந்தர்ப்பம். நன்றி.